From around the globe, thousands of transplant experts come together in Philadelphia for American Transplant Congress 2024. The Joint Congress provides attendees the opportunity to learn cutting-edge advances in research while promoting the exchange of ideas and practice in the field of solid organ and tissue transplantation.
This is ATC TV!
Welcome back to day 2 of ATC TV and to the Pennsylvania Convention Center in Philadelphia. I'm Autria Godfrey, your host. We are marking an incredible milestone this year. 70 years since the first successful human organ transplant. We reflect back on the incredible progress made over the last 7 decades with renowned transplant surgeon Dr. Joshua Mezrich.
I think transplant surgery is incredibly beautiful and I'm proud to be a part of it, but I think it's a hard road, and I think you're constantly making decisions about your patients, trying to figure out, is this the right organ for them? Are they a good candidate for transplant? Can I get them through this?
And speaking of success stories, we'll hear from those chasing their dreams thanks to donors who've given the gift of life.
She woke up and she just looked healthier immediately, like having that kidney function back. So I watched her go through that and I was like, I want to do this for someone, whether it's someone in my family or someone in need.
And today our tour takes us to Cedars-Sinai, where cardiothoracic surgeons are pioneering one of the most advanced ways to prevent organ rejection. Stay tuned. Our second day of ATC TV is full of must-see content, and we want to make sure you never miss a minute. You can find the latest ATC TV episode on the TVs in the Convention Center, on the in-house channel at our partner hotel, the Marriott Downtown Philadelphia, on the homepage of the ATC website, and on our X and YouTube channels. Now, as we mark the 70th anniversary of the first successful human organ transplant, we're discussing just how far we've come and what could be on the horizon. Renowned transplant surgeon and author of When Death Becomes Life, Dr. Joshua Mezrich, is in studio now with his expertise. Good afternoon.
It's a pleasure to be here.
All right, let's go back to Boston, 1954, that first successful transplant. Can you take us back?
Yeah, it was an earth-shattering moment. Peter Bent Brigham Hospital had been doing a lot of research on organ transplantation, but they really didn't have any immunosuppression and the outcomes were terrible. It just so happened that a pair of identical twins presented themselves. One of them had kidney failure, and it occurred to the primary doctor and the Boston physicians that maybe they could actually pull off a transplant. And in 1954, Dr. Joe Murray, a transplant surgeon, ended up performing this transplant, and the kidney worked right away.
And you think that primarily the success of that was in large part, due to the fact that they were identical twins?
Right. I mean, it definitely worked because they were identical twins. I think what they were able to prove is that they could take an organ from someone and put it into another person, and it would start working right away and work for a long time. And that was unknown. And I think they showed that there could be a scenario where an organ could be transplanted between humans and it could work. Mm-hmm. But still, they had a lot of hard work ahead of them to figure out how to do that for people that don't have identical twins.
And so to that point, when you compare what happened in 1954, the techniques used, the medicines used, the anesthesia used to today, how does it compare?
I think surgically in 1954, they had a lot of the techniques down for the operation. I don't want to minimize how much we've advanced in terms of the support we have, anesthesia, the health, how we deal with the patients. It's so much more advanced. But the operation itself was actually quite similar to what we do today. I think the biggest difference now is the immunosuppression that we have. And of course, the wonderful teams that we have to take care of these patients.
You've said in the past that transplant surgeons face a lot of tough calls. What are some of those, and how do you deal with them?
I think transplant surgery is incredibly beautiful and I'm proud to be a part of it, but I think it's a hard road, and I think you're constantly making decisions about your patients, trying to figure out, is this the right organ for them? Are they a good candidate for transplant? Can I get them through this? Maybe the hardest part for, I think, everyone is dealing with complications. We have a lot of complications in transplant. Because we're suppressing the immune system, we're taking on really sick patients. And while the majority of patients don't have these major complications, we spend all our time thinking about those that do. In terms of how I deal with it, well, That's really hard, and I think everyone has to develop amazing coping mechanisms to deal with bad outcomes. Part of it for me is being really open and honest, forming a relationship with the patient, making sure they know I will be there. Part of it is having discussions with my partners, discussing what's been going on, being able to hear from them what's happened to them. And for me, part of it is writing. I often will write about these scenarios. I find it very cathartic. I'll tell the patients I want to write about them. They usually do want to have their stories told. I don't always do anything with those stories, but I think writing out the scenarios, writing out my emotions has been really unbelievably positive for me.
Interesting. Well, we've come a long way over the past 70 years. I would love to know your thoughts on where you think we're headed next. Xenotransplantation, is that the future of transplantation? What do you think?
I think there's an incredible buzz in the air surrounding transplant right now. I think we had this quantum improvement with cyclosporin in 1983. I think the field has evolved beautifully over that time period, but there's this general feeling that there's going to be a next quantum leap. I'm a xeno-optimist, so I kind of believe in xenotransplant, but I think events of the last 6 months have shown us it's not going to be easy. And even though our successes in the laboratory have been amazing, it's not going to be so easy to apply it to humans. But I think we're going to get there. I think our abilities are way beyond what anyone could believe. Gene editing is advancing rapidly. I think there's real excitement. I think there are a lot of other advances that are going on. The organ pumping is just at its infancy, and it's going to lead to more and more and better organs. I think medications are going to improve. And I'm very optimistic. If I was a young person going into any field now, I can't imagine not choosing transplant.
Wonderful. Well, thank you so much for your time today. We certainly appreciate it.
Oh, thank you so much for having me.
Time now to take the pulse of attendees. We hit the conference floor to ask you to weigh in on how far the transplant industry has come and where will the next 70 years take us.
We've come quite the distance, as you've seen with all these posters and the sponsors and the research around here. It's every year is a new generation of innovation, and I came last year. It's so different compared to this year in terms of content and the interest that surrounds these fields. So it's a very eye-opening experience.
From 70 years ago, when we were thinking this is mostly a magical thinking, we've seen how much the multidisciplinary effort has come together to make this one kidney, one liver, one heart, whatever we do possible. It's not just one person.
Initially, that first transplant 70 years ago was between identical twins. So now we've developed new methods of immunosuppression, new surgical techniques, new ways to take care of patients, and a whole multidisciplinary team approach. So it's light years different now than it was 70 years ago.
It's been crazy to see how we've continued to innovate for these patients. These are patients that need access to care. These are patients that need to have the clinicians present through science, through data, through industry partnerships to really kind of change the course, rewrite history. So it's been awesome to see at ATC in particular how much we've advanced throughout the years and how much we continue to serve our patients.
70 years of transplants, it's going to keep going. Posters and doctors and surgeons and researchers having this individual passion of bringing transplants into what they're going to be in the next 70 years is awesome. It's an honor to even be here. But
When we talk about revolutionizing the field of transplantation, the management of donor organs before surgery is developing into a new branch of clinical science. Dr. Peter Friend, professor of transplantation at the University of Oxford, as well as CMO and co-founder of OrganOx, is here now on this trend that is changing the practice of transplantation. Pleasure to have you with us today.
Pleasure to meet you, and thank you for inviting me.
Absolutely. Okay, you are already in your company, already at the forefront of minimizing patients' wait time when it comes to receiving organs. How are you doing that?
We're doing it primarily by giving clinicians the opportunity of testing organs before making a decision as to whether those organs are suitable for transplant. And that means we place the organ in an environment where the organ is working, so-called normothermic perfusion, where the organ is put into a physiological environment, and we can test how well it's functioning in a variety of different ways.
And we should see greater outcomes when it comes to success rates by implementing that type of technology.
The biggest effect, I believe, will be in transplanting more patients,
Okay.
but there will also be benefits in terms of the immediate and longer term outcomes of transplantation.
You've also spoken about bespoke treatment of organs prior to surgery. What does that mean? What does that look like?
Well, if there's an organ which we know has got some problem which limits its suitability for transplantation, it may be that we can do something to that organ after it's been retrieved from its donor and before it's transplanted into its recipient, so that we can make it a better risk. So, for example, livers which contain a lot of fat, they may well be working perfectly normally in the donor, but once they're cooled down and transported and transplanted, they don't work very well in the recipient, and we know that that's quite a high risk, and many of these organs are therefore not transplanted. What we are testing now is a combination of drug therapy during the perfusion phase to mobilize that fat from the liver, and a filter to remove the fat from the system, to convert an organ which has got a high risk to an organ which has a much lower risk.
Interesting. You say that the isolated perfusion technology is a game changer when it comes to transplantation. Why do you think that it is a game changer, and why has it taken so long for this technology to kind of become standard?
It takes a long time to introduce new medical technology. There are all sorts of reasons why that is. First, of course, having the idea and developing the idea into something which works, suitable for translation into the clinical environment, and then the complex and perfectly appropriate complexity of generating enough evidence to gain regulatory approval, so the FDA, and finally persuading clinicians who are very willing to be persuaded, by the way, that this is the right way to go. In other words, this is a trend, this is a change which is worthwhile.
Do you see this type of technology eventually becoming standard protocol?
In a number of centres, it is becoming the standard of care. There's no question. It's not yet been adopted routinely across the board, as it were. But there are certainly what we call the early adopters are demonstrating that as standard of care, it works very well.
We've been talking today about the fact that we're, celebrating 70 years since the first successful human organ transplant. On this anniversary, I'd love to get your thoughts on how far we've come over the past 70 years and maybe where we're headed next.
Well, I think it's been an astonishing achievement. I think transplantation is one of the absolute standout achievements of the last 50 years of medical science, if you like. If one looks back 70 years, it was extremely primitive. I mean, the surgical techniques were reasonably well developed, but everything around the surgical techniques in terms of how to look after the patients during and after the operation were very different from what they are now. Now it's routine. There's a reasonable expectation that patients with terminal organ failure receive a transplant, and that transplant restores them to more or less normal life. The fact that that's become routine and people expect it is a sign of just how successful it's been. What will happen in the future, I think the big barriers will be really twofold. The first is to ensure that everyone who needs a transplant gets one, and the second thing is to ensure that the long-term long-term risks, particularly of suppressing the immune system, can be managed. And I think there is a lot of very exciting science just around the corner in terms of the clinic. So I think we will see some exciting changes in the next, well, not 50 years, the next 10 years actually.
Which is very short when you're talking about medical progress.
Indeed, yes.
Well, thank you so much for your time today. I certainly appreciate it.
Thank you.
From performing the first robotically assisted double lung transplant to pioneering one of the nation's most advanced organ rejection regimens, Cedars-Sinai's cardiothoracic surgeons routinely reinvent the boundaries of modern lung transplant science.
The lung transplant program at Cedars-Sinai has been one of the fastest growing lung transplant programs in the US over the past 3 years. From baseline, initially we tripled the volume of lung transplants we were doing, and now we've quadrupled it from that baseline.
We're doing over 60, 70 transplants a year, and we are continuing to expand on our volumes and indications for lung transplant.
We've adopted now a robotic approach that is feasible for some patients, and we've seen others take up this technique internationally. And we hope that the more we're able to bring this to a national stage, the more adoption there will be and improvement in the quality of life of patients.
I'm very excited about the future of lung transplantation at Cedars-Sinai, especially robotic-assisted lung transplant and disseminating this technology across the USA and the rest of the world for the benefit of patients.
A continued increase in organ donors in 2023 led to a number of annual record-setting trends in the organ transplantation system in the U.S. With an increase in both living and deceased donors, the gift of life is growing each year. Here now are two fortunate recipients and a living donor, each with inspiring stories to tell.
So I found out that my mom had polycystic kidney disease in high school. My first year of college, so 2009, she went on the wait list. And they said living donation would be a best option if you have anyone in mind. My dad was like, yeah, I'll do it. I'll get tested. He was almost a perfect match, which is like incredible. And just a few weeks later, they were scheduled for surgery. She woke up and she just looked healthier immediately, like having that kidney function back. So I watched her go through that and I was like, I want to do this for someone, whether it's someone in my family or someone in need. And that really started my trajectory on just like working in the transplant field. I'm not a clinical person, but I really just had this appreciation for everything that goes into transplant. So when I got to the point where I was healthy enough and old enough and I was done having kids, I was like, I'm ready to do this. So going into it, I did not know. I was basically like, whoever is in most need has access to that kidney. But I wrote him a letter about a week post-op just to say, hey, I'm so happy to have done this and I hope that you're doing well in recovery. I got a letter back from him like 3 days later, and his name is Antonio. We are the same age. He's doing as well as he can be doing recovering, and we are in constant contact. He FaceTimes with my kids and he reaches out to us, and so it's been a truly incredible experience.
I was 12 years old and I went into acute liver failure. I had gone to my local center and they transferred me to Georgetown, which was my transplant center. And after more testing, we found out that I had Chiari syndrome, or blood clots in all three of my hepatic veins, which had led to the acute liver failure. When I was 12, they decided to put a shunt in to kind of stabilize my condition a little bit before transplant, and it worked. So for 5 years, I lived with a shunt in my liver, knowing that I would eventually need a liver transplant to survive. You don't quite grasp it, I don't think, when you're 12 years old. You're pretty young, and I remember being wheeled onto the transplant floor and not understanding what that meant. Well, I was really more worried that I was missing school, and I was a competitive swimmer, so I was really worried about missing swim practice. Eventually, it started to kind of kick in. I think more so when I was discharged, you try to kind of just go back to what you were doing previously, and you realize that that's not, you just can't go back. And I think that's when it started to hit me. I started to realize that maybe I was a little different, and I had to take medication and go and do follow-up testing and follow-up appointments, and all of that kind of started to snowball. But 288 days, I received a call and I was the primary recipient. So I went into the hospital knowing pretty much that that was going to be my liver and that was going to be my offer. And the surgery went great. It was only 4 hours, which is relatively quick. The recovery was rough. I had a lot of complications with bleeding and infection, but once I kind of hit the 7-month mark, I started to get a lot of strength back, and I love my medical team. They've not only, saved my life, but kind of become my biggest supporters as well, pushing me forward to reach my goals. It's just so much fun.
Early 2019, I had an acute medical issue. I had been having shortness of breath for a few weeks, and I was actually a resident doctor in Philadelphia. By the end of 2018, I went to the hospital and I was really acutely ill. That's when they told me that my ejection fraction, which is the way like your heart pumps basically, was 5%, which is really low. And at that time, the function was so bad that the only thing they could have really done was a transplant. So I got transferred to University of Pennsylvania by the beginning of 2019, and I got my transplant January 15, 2019. Eventually found out the cause was something called familial dilated cardiomyopathy. So it had been a genetic defect that I really never knew about until I was about 30 years old. We did the surgery. I really didn't have any complications or anything post-operatively. I feel like I was finally able to take my first breath with a new heart, and I really felt like rejuvenated. I am so grateful for the impact that my organ donor Lucy had in my life. She's the true superhero. So it was 4 people total. It was me, 2 kidney recipients, and a liver transplant recipient, and her family actually was in touch with all of us, so it meant a lot to her family too.
I'm forever grateful for my donor and their family for making the selfless decision to donate and save my life. The impact that they have doesn't just impact me, it impacts everybody in my life. So to potential donors, thank you. You save people like myself, and I'm extremely grateful for it.
Living donation has been such a gift. I have seen so many lives change, not just Antonio's, not just mine, but our friends and our family, my colleagues. So many people who just ask me questions about it, like, how does your life change now? What's going on? Or, do you have impacts for life? And my life hasn't changed, except that I know that there's someone healthier on the other side because of it.
Absolutely incredible stories of a second chance at life, all thanks to you and your fellow transplant professionals. With that, it's goodbye. You can find the latest ATC TV episode on the TVs in the Convention Center, on the in-house channel at our partner hotel, the Marriott Downtown Philadelphia, on the homepage of the ATC website, and on our X and YouTube channels. We still have one very special episode still to come tomorrow. We are tackling the latest trends in transplantation. Still a lot to come as we finish up our week here in Philly. We'll see you right back here tomorrow.